Methicillin-resistant Staph aureus is an epidemic in America, an epidemic in Western Pennsylvania, and an epidemic in our own hospital.
Dr. Richard Shannon is Chief of Medicine at Allegheny General Hospital in Pittsburgh.
Good morning. Good morning. This is a very unfortunate case of a young man who had a stroke. He came to us after a long hospital stay at another institution, and when he arrived here was found to have methicillin-resistant Staph aureus in his urine. He's had to undergo a surgical procedure to clean up a part of his leg where he had this infection.
He looks scared almost all of the time, especially when he sees me. He cries.
Marilyn McNowski is patient David McNowski's wife.
It's been extremely hard because it's just he and I. And he's basically my life. And it's kind of hard to live my life without him being there.
Across town, retired attorney Bill Hackney's artificial hip was infected with MRSA after he began dialysis.
They thought it came through the port for his dialysis. The needles, they weren't sure, but it was in his bloodstream, all through his bloodstream. The doctors never let us think or mention the fact that this could be a problem of the hospitals or theirs. It's just something that happened. Our lives are totally changed, I think, probably forever.
I think it is totally within the realm of our possibility, given the resources we have at hand, to dramatically reduce the incidence of methicillin-resistant Staph aureus.
But with no good medicines to cure MRSA, there's only one way to beat the bacteria: prevent its spread in healthcare facilities.
Hi, Mr. Moyle. Hi, Doc. How you doing today?
At the VA Pittsburgh healthcare system, Dr. Robert Mutter is Chief of Infection Control.
If hospitals had a comprehensive program to reduce or eliminate MRSA transmission, there would really be no way for patients to acquire MRSA. What that would really take is for all the hospitals, nursing homes, healthcare facilities in a region to get very, very aggressive about controlling the spread of MRSA from patient to patient.
By setting 0 infections as the goal, Shannon's team slashed the number of annual central line infections from 49 to 6, and the number of patient deaths from 19 to 1.
Good. The site looks nice and clean.
UPMC Presbyterian Hospital nearly wiped out MRSA in one ICU.
Our results are fabulous. We had a 90% reduction of MRSA infections in our medical intensive care unit. We've essentially eradicated infection in that unit.
A 3-year campaign against MRSA at the Pittsburgh VA produced similarly impressive results.
So there is something you can do about it. In fact, we've known what we can do about it for decades. The problem has been getting people to actually do it.
When I found out David had this kind of infection, I was angry at healthcare that they didn't see this coming somehow.
I was confused, really bewildered by the whole thing, I think, because, you know, you go to the hospital to get well. And the doctors come here now.
People oftentimes water down the moral imperative by saying, look, I'm trying. What I'm saying is that you need to see that there are better ways to do this, that you can eradicate methicillin-resistant Staph aureus. You take the harm that methicillin-resistant Staph aureus causes, and you confront healthcare providers sworn to prevent such harm and say, is this acceptable to you?